The COVID-19 epidemic is influenced by a variety of factors, and if vaccination alone is relied upon, there will be a prolonged tug of war and depletion between humans and the COVID-19. The human society will not be able to quickly return to its previous normal social state. At the current rate of vaccination, it would take another 7 years for the world to return to its pre-epidemic state. But this projection does not take into account the mutation of the COVID-19. Moreover, the main function of the COVID-19 vaccine is to prevent vaccinees from getting sick. It does not completely prevent them from being infected or spreading the virus. And for some pathogens, it may promote mutation of the pathogen when the vaccine cannot eradicate it. Media reports of 60% to 95% effectiveness of the COVID-19 vaccine refer to efficacy immunity, not elimination immunity. Under this, people who are released from the virus and infected, but not sickened after vaccination, would become asymptomatic virus transmitters. If a country has universal access to the vaccine, but the population stops taking protection, the number of apparently confirmed diagnoses falls, but the actual rate of infection keeps increasing. When antibodies decline to a certain level, or the virus mutates, a second outbreak is likely to occur. Current vaccination measures fall into two categories. In vitro measures, minimizing the chances of the virus entering the body, such as maintaining social distance, which can greatly reduce droplet transmission, avoiding gatherings, ventilation, frequent hand washing and disinfection, wearing a mask, isolation, etc. In vivo measures, to remove the virus from the body as much as possible, or to control the replication of the virus as much as possible. For example, natural immunization, vaccination, immunity boosting, medication, etc. It is not realistic that a new and effective drug will be available in the short term. So until then, it is important to improve the protection of groups in high-risk areas, including their personal protection and the personal protection of the general population, before an ideal vaccine or drug can be developed. Large establishments such as businesses and schools need to be protected in advance, with staff and students being educated about protection, different measures being taken depending on the risk and epidemiological situation, and attention being paid to the ventilation and disinfection of crowded rooms. As people in the home come into contact with each other on a daily basis and are in indoor spaces, family members can easily infect each other in the event of an outbreak, making it all the more important to be prepared in advance, just in case.